Mucormycosis or the black fungus disease is a deadly disease, but it is a very rare disease. Through this video, I would like to alleviate some of your tensions and concerns surrounding this disease. This disease has come into light of late in India because a few patients who have recovered from COVID-19 have shown mucormycosis. In today's video, I am going to tell you what is this mucormycosis, what causes it, what are the signs and symptoms of the disease, and how you can keep yourself away from this deadly disease. We have been hearing in the news of late how this disease is being spread through the oxygen supply, and I am going to give you a very important tip in this video how you can prevent it. I am going to try and keep this as simple as possible, and I am also going to tell you through this video when you should be concerned about mucormycosis. First of all, what is mucormycosis? Mucormycosis is a disease caused by a fungus called Mucormycetes. It was earlier known by the name of zygomycetes. I remember this when I was in college. So where are mucormycetes found? Mucormycetes are found in the soil, they are found in dead leaves, rotting wood, and like. The disease is transmitted through the spores of the mucormycetes. And where are the spores found? It is all around. You can call mucormycosis as an opportunistic infection. It does not affect otherwise healthy people. Mucormycosis grows in an environment which is high in glucose, high in sugars, and also acidic environments. So it affects people primarily when they have uncontrollably high diabetes, and when the blood sugars are uncontrollably high, we are talking about figures over 400 mg per dl, we can have a situation known as ketoacidosis. Another risk factor for mucormycosis is when the patient's immune system is suppressed. We call it immunocompromised. It could happen in patients who have cancers, who have had a recent organ transplant, or since we are limiting ourselves today to COVID, who have received a long-term steroid therapy. Remember, the mainstay of treatment in the inflammatory stage of COVID-19 is steroids. However, in critically ill patients, they tend to receive steroids for a long period of time. So in essence, the person who is at risk of mucormycosis is the patient who has been critically ill in the ICU for a long time and has been receiving a high dose of steroids and has had uncontrollably high blood glucose levels. So that is why most people need not worry about mucormycosis. It is a very rare condition. Let us get into the signs and symptoms of mucormycosis. It affects four main systems: the nose, eyes, and brain, the lungs, the gastrointestinal system, and the skin. But it has been noticed that in COVID-19, if it does occur, it affects two main systems: the nose, eyes, and brain, and the lungs. In COVID-19, suspect mucormycosis only if you meet the risk group criteria. That is, you have been critically ill and were on steroids for a long period of time, that is high dose steroids, and have uncontrollably high blood glucose levels. If mucormycosis affects the nose, eyes, and brain, expect symptoms like severe nasal congestion, highly inflamed sinuses which cause a lot of pain, severe headache, blurry vision, and also quite a high fever. Keep an eye out for smelly discharge coming out from your nose. You might also get what we know as periorbital edema, that is a big swelling around the eye which is very painful. Also associated with mucormycosis are facial palsies, that is any weakness of any muscles of the face. So keep an eye out for these symptoms if you suspect mucormycosis. If mucormycosis affects the lungs, you might start out with high fever, expectorant cough, and this expectorant which you bring out might have frank blood in it. Remember, just because it is called the black fungus disease, it doesn't mean that you will have black mucus. The fungus itself is invisible to the naked eye and can only be seen through microscopy. To prevent mucormycosis, the number one thing you have to do is to control your blood sugar levels. If you are starting on steroid therapy, it is essential that you start it on time and at the right dose, not too early, not too late. This is the reason steroids are not available over the counter. It can only be prescribed to you by your doctor. And once prescribed, your doctor will have to monitor your progress. In the news of late, there have been quite a lot of statements that mucormycosis is spreading through the oxygen supply. This in a hospital atmosphere is quite unlikely, but it could happen if you are using an oxygen concentrator at home. You see, the oxygen concentrator has got a bottle where you fill water. The spore of mucormycetes are found all around the environment and also in the water. So ensure not to use tap water in the oxygen concentrator. Go to your pharmacy and ask them for distilled water. Use this distilled water instead to avoid conditions like mucormycosis. I hope this video has given you some value. Subscribe if you haven't subscribed already. Like this video. I'll be seeing you in the next one. Signing out, Dr. Rohan Fonseca.